Hello, welcome to the EURACTIV Anti-Disinformation series. Today we'll look into the European Union's pandemic policy, vaccines, and the impact of the spread of COVID-19 disinformation on democracy. I am Karolina Zbytniewska, Chief Editor at EURACTIV Poland, and I have a great pleasure and honor of introducing to you our today's guest, Sara Cerdas, a Portuguese medical doctor and politician who serves as a member of the European Parliament and at the Committee on the Environment, Public Health and Food Safety. Welcome.
Thank you. Thank you for having me here.
First, though, I will offer a very brief introduction to the topic, offering to you two very short but juicy examples. And so online platforms directed by Russian intelligence are spreading disinformation about coronavirus vaccines used in the West while praising the safety and efficacy of the Russian Sputnik 5. But disinformation does not only concern the vaccines themselves, but also the threat of COVID-19 virus itself. Often it's also coming from the authorities who either deny its gravity or, like Belarusian President Alexander Lukashenko, encourage citizens to drink vodka and visit the sauna twice a week to stay healthy. Sara, are such top-down disinformation campaigns, often totally irresponsible but geo-economically strategic, a sign of our times?
Hello, that's quite an interesting topic and discussion to have here. Disinformation has been one of the constants here during this pandemic. Dr. Tedros from the World Health Organization has even stated that we are in a pandemic of disinformation also, and this is a sign of our times, of the times where we're dealing with the worst pandemics in the last 100 years with the globalization. What is important for people to do, because it's really hard to disentangle what is a fact, what is a non-fact, with all this news coming or information coming that we don't know if it's correct or accurate or not. It's important to check the sources and to understand that there's reliable places where one can find information. I can give two examples. One of them is the ECDC, European Center for Disease Prevention and Control, which is an agency by the EU, which is doing it's on the front of the fight of this pandemic of COVID-19, and also WHO, World Health Organization. So it's very important that when we share this information in our social media, that we understand the source and that we do not share things that we are not that is not reliable or that we do not know where the source comes from. So I think everyone has to play a role in the fight against disinformation, because it's really important. I mean, you stated the example about drinking vodka and so on. You had Trump last year stating, oh, maybe we can inject ourselves with antibacterial substances. And
yes.
Yeah, and all of these things just generate a lot of noise and generate a lot of a sentiment that citizens are already very tired of this pandemic, and the fact that we don't know where to reach true information or fact-based information can lead to more stress.
Thank you. How could countries reach countryside and rural areas, not only with vaccines, but also with proper, reliable knowledge about them?
Sorry, can you repeat the question?
How could countries reach countryside and rural areas where people are often not having good access to internet and the media with reliable knowledge about the vaccines, not only with the vaccines themselves?
Yeah, that's a topic that we should explore, which is cohesion. And we should work not to leave anyone behind. And of course, there's a high influx of information in more urban areas, but we must not forget rural areas and those that are more farther apart. And we need to work together not to leave anyone behind. That's of the competence of national authorities, health authorities, to be able to work for better accessibility to health. And that also relates to better health literacy. And that's something that should be worked among national and regional authorities together with the guidelines of European Union.
And a question in the context of inequalities, how the disinformation affects different countries in this vaccines and COVID-19 context?
Yeah, I believe disinformation affects every country, every region. The approach here and the strategies shall be to be coherent, to explain and work better on health literacy, and actually explore how can fact-based, evidence-based information reach citizens. So this can be fought on. This misinformation pandemic can be fought on.
And further poorer countries, like, for example, Nicaragua, Barbados, Trinidad and Tobago, or Madagascar, receive vaccines through the COVAX facility. Still, can we say that the world is anywhere close to the equitable distribution of COVID-19 vaccines?
No, not even close. We're not close to being equitable distributed. And you see the countries that are more advanced in the vaccination rates, inoculation rates, are the ones that least contributed to the COVAX mechanism. I'm talking specifically about the US, the UK, and Israel. And we know that the EU is a bit lagging behind when comparing to those three countries in proportion. But we must not forget that quite significant percentages of doses in the EU has been gone to the COVAX mechanism. So all these countries that are low and middle income countries should be getting more dosages, because we must not forget that we're only going to turn the page on this COVID-19 pandemic when we have immunized population. So when we reach the so-called herd immunity, and that will only happen when, at least that's the figures we have for now, but it will happen only when we have 70% of the adult population inoculated. And that we're still very far behind on those numbers. We're having a lot of good progress in the EU. We have been working really hard on the joint acquisition of vaccines, and that has been really good for the EU project. But we must not forget, and rich countries must not forget, that this is a pandemic. This means that it went beyond 2-3 continents, and we need to help those that don't have enough resources to also reach these immunization rates. This is of the utmost importance. And I would like to recall what Dr. Tedros said last week, which was, it's in the point of view of fighting a pandemic globally, it makes no sense to start vaccinating teenagers, as the US is doing now, when we have countries that not even their healthcare professionals, meaning the people in the front lines, have been immunized. And this is the only hope we have in regards of overcoming this pandemic. And we need to look and be have more solidarity with everyone and reduce these inequalities in the accessibility to vaccines.
Thank you. And how can we reduce vaccine anxiety that we encounter at the moment, and make people less vulnerable to disinformation and conspiracy theories?
Yes, that relates very, very well with the disinformation pandemic that I was speaking against. about before, and what we need to assure to do is to give the stage to our scientists. Scientists, I mean, I'm a politician speaking to you, and I'm also a medical doctor, but we should put science on the highlight. They should be on the focus to be able to portray the technical expertise they have in regards to reduce this anxiety and this vaccine hesitancy that has been going on. I would like to remind that vaccines go through a really strict safety procedures when they are developed. As in anything that we do in life, there's always risks. What we must do is, if the risks outweighs or underweights the benefits, and vaccines, the ones that have been approved by the European agencies, Medicines Agency, have been deemed safe and efficient to reduce serious, moderate to severe cases of COVID-19. And that's very important, because that's the part that strains healthcare systems, and that's what makes this pandemic very hard to tackle, is when the healthcare services are strained, that they cannot tackle other diseases and other pathologies.
Mm-hmm. Two more short questions, and we'll be ending this interview. So first one, very short, because as COVID-19 vaccines become widely available, but you are still saying that we are far from the herd immunity, and some employers want to make them mandatory for their employees. What do you think about this idea of making anti-COVID-19 vaccines mandatory for the citizens?
Okay, I should give you some background on where I come from. I come from Portugal. Since 74, we had our revolution, democratic revolution, very peaceful. We call it freedom revolution. And before that, we were in a dictatorship. So there was a lot of our population didn't have access to education, to health services. And that meant that young children, the death rate of young children was very high. Then after democracy came, and we had the national healthcare system where people had access to healthcare services and also education, and that reduced greatly our death rates in our children because they had access to vaccines. So in Portugal, vaccines are not mandatory, but we have one of the highest vaccination rates because people still remember what it's like to die from rubella, to die from diphtheria, and to die of whooping cough, and all these diseases that have been are not there anymore because we managed to vaccinate and protect our children and our citizens. So we don't have that problem here. We don't have that much vaccine hesitancy because citizens here in Portugal remember what it's like of dying of a preventable disease, a vaccine preventable disease. I am against of making vaccines mandatory because I believe anyone should have this sort of freedom on what comes to their body or not. But this freedom shall come with right to information, so that you can decide with the best available evidence, with the best available facts. Me, myself, I'm a politician, but before that, I'm a medical doctor and always will be. And I highly recommend any vaccine that has been deemed safe and secure by the European Medicines Agency. And I usually, I don't have my vaccine yet. And I usually say, people want to ask me, which one are you taking? And I just reply, the one that's available, the one that they want to give it to me, because that's the beauty of the EU. We know our safety standards are very high, so we work to have that, and we know, I know it's safe, and that's the message I want to take it out.
So as you're saying, in Portugal, it's a matter of a historical experience and
cultural, yes.
Yes, and in a way of education, but also of trust. and
Yes.
in a way of leadership. And here comes my last question about the last WHO report, which in the first place criticized all the countries of the world of how they tackled the pandemic, meaning at the very last moment. But also it says that it exacerbated inequalities, global inequalities. And it's, to quote it, global political leadership was absent. What do you think such leadership could look like, including that of the European Union? And it will be my last question.
That's an interesting piece because WHO was a bit shaken during the pandemic because they are the ones that state, okay, this is a public health of international concern, public health emergency of international concern. But then member states are members. The WHO as an institution doesn't have a power to implement measures, only has the power to give directives and to recommendations. That's a bit what happens in the ECDC. In the EU, we know that provision of healthcare is a competence of member states, but we have something that was quite explored in this pandemic and very well explored, in my opinion, which was that public health protection is a shared competence between the Union and member states. And that's when we kick out the European Union Health Union package with strengthening and improving how we respond to emergencies, the EU for Health program. What you're saying is true. We needed more leadership. I think nobody was ready, but they were advised. I mean, there was a warning in 2018. There's a blue print from WHO stating the 10 diseases to follow with the pandemic potential, and there it was disease X. So it was not because of lack of warning. There was a lack of global health leadership because health, it's mainly seen as a competence of member states as it is in the EU treaties, and also health is looked as only as the healthcare sector and not more broad, and not that education level of a population affects the health level of a population, not that better air quality decreases the disease burden from pulmonary diseases later on life. And this is all the determinants of health, the factors that influence the health status of a population. And this now it's being explored now, and we have the momentum of putting health in the center of our decisions, at the center of the economy also, because we saw how if we don't take care of our healthcare systems, how the society crumbles apart, because it's one of the essential services of society. And right now, I believe WHO should work together with its member states to have some kind of reform on its attributions, and also help the low and middle income countries to reduce the inequalities for the high income countries, because I believe this has been quite exacerbated during this pandemic. A lot of reflections are coming our way and need to be done. At the EU, I'm very glad that we have been doing that, at least in the ENVI committee, and together with other committees. And yeah, I'm quite hopeful, but we need to really discuss all these topics. And I think after a few more months, when a more population in the EU is immune, we're going to start forgetting about health, and we must not do that, because health should be at the centerpiece of EU policies.
Yes, I have this reflection that the pandemic works as a magnifying glass, showing how much education, geopolitics, and public health are interconnected, and also
Yes.
How European Union needs more unity.
Yes.
Thank you very much for all these insightful answers. Our guest today was Sara Cerdas, a Portuguese medical doctor and a member of the European Parliament. Thank you and goodbye.
Thank you very much, Karolina, for the invitation and for this conversation.
A pleasure was mine. Thank you. Bye-bye.
Bye.